to the Be Real podcast, where we chat, connect, and keep it real with stories that heal and truths we all feel. I'm your host, Brittany K, and I got something to say. Today, we're talking about the health of our brain. We have an upcoming event. It's Brain Health and Early Intervention Summit, and it's put on by the founder of the LaLa Speaks Foundation. I'd like to introduce you guys to our guests for today, Miss Jazzie Ford. Welcome to the Be Real podcast.
Thank you, Brittany. I'm so glad to be here.
Very good to have you. This is not our first time meeting. You've been on the show before, continuing to spread awareness about brain health and brain aneurysms. So for folks who aren't familiar with your foundation, how did it all get started and who was the reason why?
So, our reason is every 18 minutes, someone suffers from a brain aneurysm rupture. And I didn't know the warning signs until my daughter passed. So, the foundation is in honor of Jacqueline LaLa Roan. She was a minister. She was a counselor, and she was a blessing to the community in so many ways. So by losing her, that was just extremely tragic. Not being prepared, not that you really can be prepared for someone to leave you unexpectedly, but to have learned in neuro ICU about brain aneurysms and the experience. I have to say, I don't do hospitals, I don't do funerals. None of those things were my comfort zone. I just never go.
Right. Not many people's either.
No, but
Yeah.
I don't go. I have a disclaimer. I have a list of funerals that I'll attend. I just don't go. And I was involved in that whole process from the doctor's visit, the 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 I the emergency room visit, the escalation to be put into ICU, being diagnosed with the brain aneurysm, and to see her transition into a self-induced coma, and to also have to make a very strong decision that even now I live with, to take her off life support. And I shared, I don't do funerals. I had to prepare my own daughter's funeral, my only daughter.
Yeah.
Okay. So, with that being said, even though LaLa was an ordained minister and I grew up in church and I have strong beliefs, it was never my desire to take on this
Right.
mission. But because I have faith and I grew up in the church environment, it's like she sprinkled something on me. And so I told God, after I took her, made the decision to take her off life support, I was, okay, God, you said you needed my baby. You took my baby. I want to trust you. I still question you, but this is what I want. And I want a foundation to share with the community so no one ever will have to experience the loss that I have when we are going to make it available to the community, what the signs are, and that early prevention can change the outcome. So in that ICU emergency room, I made that decision. And I also made the decision that I want to have her celebration of life on her birthday, which is May 28th. And I did that. So that's what I wanted, and that's what I was blessed with. And that is the reason why we started the foundation.
Beautiful. You first mentioned the reason behind it, as far as just not really knowing, much information about brain aneurysm, and you said every 18 minutes one ruptures in the US. So I want to take the time to educate our viewers on everything that we need to know the signs, what it looks like, some things that you were unfamiliar with that was surprising to you.
Exactly.
So go ahead, lay it out for us.
So I'm going to use the mommy version.
Mm-hmm.
So Lala experienced a lot of the signs once it had ruptured. And that's the sad part, because once it actually ruptures, if we're not sure of the signs. So Lala experienced, we'll start with the ears. She experienced where she felt like her ears were clogged. Nothing, no different than any of us. I feel it all the time. Early this morning, my ears have felt like dirty. And she went to the doctor about it, and sharing that, cosmetically, she was referred to get an over the counter ear cleaning kit. So I want to do this breakdown because this also positions us on the why we're having the summit and why we want certain faces in the room.
Mm-hmm.
So with the ears, if you're an ear, nose, and throat specialist, the doctor's done nothing wrong.
Mm.
Let's start that way. So hearing loss is a symptom.
Mm-hmm.
If you're experiencing, some issues with your ears. Blurred vision is another symptom. Blurred vision or double vision is how it is shared. So, so by my daughter passed in May, I had to take off support in May. So in April, most of these things she was being seen for.
Mm.
And all of these things that I'm sharing now were the answers to. So with the blurred vision, she was driving, and it was kind of spoken jokingly. Mommy, I almost killed myself on the road today. There was crying. Everything just looked really blurry. I
Mm.
don't know if I want to. I say, baby, it's okay. It's okay. She's like, I want to get my eyes checked.
Mm-hmm.
So blurred and double vision is also a sign
Mm.
of the 6 signs that you should caution, which are similar to everything else. She did get that checked. She
Mm.
went to an ophthalmologist, and she was given a prescription for some more glasses. So she walked in with no glasses, left with bifocals, and a couple of days later, her eyes were deteriorating even more. So keep in mind, we started off with the blurred vision. I
Yeah.
can't see. We have bifocals. They give her that. So she goes back. I was like, well, something's wrong. And so she goes back, and they say, well, maybe you just not clean them, your glasses. So they cleaned her glasses, and they told her to wear them as much as possible. So Lala did that. She was wearing the glasses except when she was asleep.
Right.
So, which she had already been doing. But by that time, her eye did a little slick Rick. And, one eye down, which resembles Bell's palsy.
Oh.
So this is another association why I share the conversation is important, because it's not to point fingers, but it is to share the lack of awareness and the gap between specialties that don't align with what's going on with the patient because they don't see full history. So we have that.
Mm.
And she was then diagnosed that she had Bell's palsy. Well, Bell's palsy is not fatal. It can be temporary based on, and some people do live with it forever, but some of the symptoms they're similar
Mm-hmm.
to other symptoms. Just another thing to share. So with her having having that, she claimed it because that's what the doctor said. The ophthalmologist told her that. She's walking around saying she has Bell's palsy. The eye is getting lower. She goes back, and I was like, and I need to reverse, because before they said the Bell's palsy, I'd stated the place that she went is not known for prescribing wrong prescriptions,
Right.
right? So no fingers pointed, but what I am saying is you don't just come in with no glasses to bifocals to one limp eye. Something's wrong with,
Not a
again, my
Bell's
baby.
palsy.
Yeah, at that time my daughter was 39 years old. So you don't go to doctors with 39-year-olds that don't have disabilities. I'm going to the doctor with her. We're going back because they sent her home. I'm like, this dirty glasses thing, we're not riding with that.
Yeah.
So I went back with her, and then that's when they diagnosed the uh, the Bell's palsy, and that she should see an eye specialist for it, and with no sense of urgency. Okay, and that she should return in 6 months if it doesn't resolve.
Mm.
So I share this only to bring out the timeline to associate with symptoms, how they can mimic other things, and how they can be underdiagnosed.
Yeah.
To combine another symptom is confusion. Well, guess what? Anybody can be confused. My daughter has started forgetting things. And all of this is in addition to. So I say this because we don't want to alarm the community, but we want to say that when you get these signs suddenly, you should be concerned because this is more than one thing. We're rolling in other lanes.
So within like the what's the time frame from when she started to have the symptoms to when they told her to go and see an eye specialist with no urgency? Within that time frame, how many months was that?
About 30 days.
That was only 1 month.
That was 1 month. Now, as far as she started speaking with what sounded like a lisp,
Mm.
my daughter didn't have a lisp. And that would have been maybe 2 or 3 months prior. And the doctor told her it was her wisdom tooth. So that's why we kind of wanted to associate dental in it, because when your tooth hurt, what can it have? It can mess with your eyes, things behind your eye. You can have pain behind your eye for your pupils, for a headache, a migraine, but also a brain aneurysm.
So after the 30 days, was that when they finally diagnosed her with the brain aneurysm?
LaLa was diagnosed for a brain aneurysm on May 7th, and it ruptured on May 9th, and she went into the coma on the 9th. So I didn't
Wow.
know anything about it. And why this demands a sense of urgency is that Dr. Caruth with Barnes Jewish in Neuro ICU stated that she'd live with it at least 2 to 3 years.
So she had more time than what she was
Right.
given. Wow. So this is a very telling story of just, I'm sure, one of many cases where family members are not aware of what a brain aneurysm is, what the symptoms look like. And this is the entire reason why the LaLa Foundation even is created. So we're going to take a break, but when we come back, we're going to talk about the Brain Health and Early Intervention Summit, how you can attend, and what will be beneficial for you there. So keep it here, the Be Real Podcast. We'll be right back. Welcome back to the Be Real Podcast. We're continuing the topic about the health of our brain. We're doing that with the founder of LaLa Speaks Foundation, Miss Jazzie Ford. Thanks for continuing the conversation.
It's my pleasure. I'm always happy to be able to share anything about the foundation as a young grassroots foundation. The impact that we're wanting to make is overpowering with the time that we've already been in existence.
Yeah.
So this brain health and early intervention summit is important for a lot of reasons. One, it is to visibly make ourselves available to the public to know who LaLa Speaks Foundation is, why we matter, why we're here, and what we plan to do moving forward. And by having that summit, it allows us to put a diverse audience in one place, asking officials, community leaders, survivors, caregivers, people that take their health very seriously, or even if they don't, people that want to know. So on May 28th at Post Hall,
Mm-hmm.
we are having pre-networking at 8:30, 9 o'clock starting the program promptly. We will be amplifying every 18 minutes because someone in the U.S. suffers from a brain aneurysm rupture.
Amplifying every 18 minutes. What does that mean?
No one knows
Mm.
that every 18 minutes someone suffers from a brain aneurysm rupture, and many don't know the signs. And LaLa Speaks is here to change that. So every 18 minutes is going to be our our tagline leading up to Brain Aneurysm Awareness Month in September.
Gotcha.
So that's why that's not even all because Kimberly Ann Collins has sponsored a bill. Many may not know that Brain Aneurysm Awareness Month is recognized nationally, but state to state, it's not a conversation or a voice in the community. And LaLa Speaks wants to change that. And with the help of Kimberly Ann Collins, she sponsored our bill. She pushed to get Brian Seitz to co sponsor, who also urged John Patterson, Speaker of the House, to push the bill to the Senate. So we will be sharing that that bill has been truly agreed and passed on for Governor Kehoe to sign. So whereas many people had said when I got a proclamation in 2025, you can't do this. Yes, we can. With the right voices and the right help, we are able to make things possible that people say are impossible. We are also honoring LaLa's legacy. Her life matters. And as I can't bring her life back, I can help save lives to arm the community with the warning signs. And not only arm the community with the warning signs, her celebration of life is on that day. It's the day of her birthday. And we want to publicly make our voice known as a trusted voice in the community. And not only to bring awareness, but to bring pathways to support the community because flyers are just not enough. People need to know and feel heard, feel seen, and to follow trusted voices. So we're extending and expanding our pathways because we've already been boosted ground, but nobody really knows. So we have our Reclaim and Rise, and everything is with LaLa. LaLa Reclaim and Rise STL. What does LaLa mean? It means lift, amplify, love, advocate. So they'll be seeing that along with our every 18 minutes because we want to support the community. We have opportunities for the workforce. We have free creative pathways for the youth. So this is our call to action that we are no longer looking for logo placement. We are looking for long-term relationships to build the foundation for brain aneurysm awareness, just as any other cause has done, starting from scratch, making it amplified throughout the state of Missouri. So, for those of you that don't know, we're having the summit. We are. We can be found at LaLaSpeaksFoundation.org.
LaLa, I do want to pay attention and shed some light to the doll that you have sitting in front of you. You take it wherever you go. For our audience, can you tell us what it symbolizes?
It symbolizes my support through LaLa Speaks. I speak through LaLa.
Mm-hmm.
So she is my support when I go out. and it has her heartbeat in it.
Mm.
So that's why she's so important. You literally will see me with her everywhere.
Mm. So, for folks who are going to be coming to the summit, it's happening May 28th at the Post, Press Hill in St. Louis. It's the Brain Health and Early Intervention Summit. Where can they find more information and also just be of support to you throughout your journey?
That's a great question, and thank you for asking. So there's many ways that you can reach LaLa Speaks Foundation. One's through the website. It's lalaspeaksfoundation.org. We are on all social media platforms as LaLa Speaks Foundation. We also can be phoned into 314-816-0067. And we really would love for the community to reach out if they need any help. It's important to visit the website because the website is the home playbook for everything that we do. So for those that have no clue what LaLa Speaks Foundation is doing, we share everything publicly in reference to our events, but most importantly, everything is housed on that website. They can find the pathways for the Reclaim and Rise STL. They can find the LaLa broadcast from the block to broadcast. That's a, a partnership with VOP STL News. And we have an open call for that currently that many people don't know. And Cardinal Cares actually has sponsored one of the sponsors for that program. So check us out. You'll find out that we are doing some very amazing things in the community, but you don't know what you don't know.
That's right. That is so the truth. So, again, the Brain Health and Early Intervention Summit will be happening May 28th. They're also going to be celebrating the life of Jacqueline LaLa Rome. They're going to be having this summit to bring together medical voices, community partners, families, caregivers, advocates for life saving conversations, and the warning signs for brain aneurysm. So make sure your face is in the place, RSVP, so that they make sure they know that you're coming, and give Miss Jazzie Ford a like and follow on social media. Plus, your girl Brittany K at Brittany K TV _ on Instagram. That's going to do it for the Be Real podcast. I hope you guys are informed. I'm your host, Brittany K. Have a good day.